Happy Sunday afternoon. I'm coming at you all live today from my bedroom. I got kicked out of my son's room. Logistic problems. So, how is everybody doing? Actually, this is not too bad. I think I'm going to stay here from now on. I don't like to sit, but oh well. I'm gonna sit and I'm gonna hopefully make some points. Hi Alice. How are you? Good afternoon. I don't know. I couldn't get your name out. But how is everybody doing? Buenas tardes. Happy Sunday. My name is Dr. Lulu. I'm a national keynote speaker on child, teen, and young adult depression and suicide. I am AKA the momatrician. So if you don't know me, that's who I am. I'm a pediatrician, board certified, and I'm a mom. And that's who I be. So we're going to get started. Today, I wanted to do something different. I've done this one other time before in the past. I've had a question and answer session. So if you're watching me and you're a mom, or your friend is a mom, or you have I don't know, sister who's a mom, or you're a dad, I never want to forget the dads, but if you're a parent of a teenager or you know a parent of a teenager, have them join in today because we're just doing question and answer session as long as the doctor can get her words out. So I see Ellis on Ask Dr. Lulu, so I know that's working. No one on Teen Alive, no, that's okay. And I see Veronica Gary's, Kristen Therese, and of course, I'm watching. How does that happen? Okay, well, anyway, so we're just going to do question and answer session today. I have 4 or 5 questions that came over the week. So I'm going to try to see those guys. Okay, good. Over the week, and I have those questions already, but I figured if you guys have any questions of your own, just go ahead and ask me, please. And we can get started. If you have any questions about your teenager or even your toddler, your regular child, I mean, if you have any questions about parenting, well, I'll give you guys a couple of minutes. Maybe we need some more time to kind of just warm up a little bit while I also invite my friends. But I actually like it. I'm coming at you guys live from San Antonio, Texas. It's nice and warm today. Not too warm yet, thank God, but I'm happy to announce that I'm sitting down for a change. So Anjali said hi. Hi, Anjali. And I'm just going to ask the questions that I have, okay? So my first question is came from one of my moms over many moons ago. She had a 15-year-old son, and if you've heard the story before, well, she had a 15-year-old son, and she was concerned that he wasn't himself. He wasn't doing the stuff that he likes to do. He was the quarterback in the football team, and he wasn't happy playing football anymore. He just wasn't himself. He didn't want to be himself anymore. And so she was worried about, could he be using drugs? Which is a fair question, I think. Could he be doing drugs? What do we have to do about it? What should we do? What should we do? What should we do? Thank you for the loves and the hearts. I appreciate them. Please keep them coming and invite your friends if you have any friends who are parents and who have kids. Well, my wife is in the building. Wow, this is good. So she wanted to know what was going on with her son, why he wasn't, interested in playing ball anymore like he used to, and why he just, was losing interest in his activities. So of course he came to see me, and we did what we call a PHQ-9, which is a screen, and those of you who are doctors who are watching me know, it's a screen for depression. They have a modified version for teens. So we did that, and it's actually X amount of questions, I think 9 questions, and you have to answer, you have to kind of grade yourself. And so he's out of 27, and he scored a 23, which is pretty high. At that time, I did not think he was suicidal. I have to say that. But I did tell the mom that I thought he was extremely depressed, and we really need to. Oh, I have a question. Elizabeth has a question about ADHD. What do you recommend for a 12-year-old girl to stay focused at school without resorting to medication? Elizabeth, hold that question. I love it. I'm just giving a question a case that I had a while back, but hold that question. Good question. Anyway, to cut a long story short, I told the mom he was severely depressed, okay? And I thought he needed medication and he needed counseling. And believe it or not, the mother said to me, and I quote, that if it's just counseling, don't worry about it. If it's just medication, no, actually, she said if it was just depression, don't worry about it because, you know, I was depressed, meaning her. She was depressed. Her sister was depressed. Her mother was depressed, and they all did okay. And he was going to be fine. So for those of you who know the story, you know that subsequently he didn't get any medicine, he didn't get any counseling. That was in March. And in July, during 4th of July celebration, he put a double-barrel shotgun in his mouth and pulled the trigger. So he killed himself, okay? And so the reason I brought that up, because it's a very dramatic story, but it's a real story, is my patient that actually died of suicide because his mother thought she had it all together. His mother thought he's gonna be fine. It's not it's just depression. I mean, it's not a big deal, you know, but it was a big deal for him. And so the main question today is, parents, are you listening to both the things that are said and the things that are unsaid when it comes to your child, to your teen? And Latoya is watching. So Latoya, you had a very good question, and I have your daughter's question on my list to ask. So maybe you want to ask it yourself since you're watching. But essentially, you have to listen to your kids. And also, if you bring your child to the doctor, you really ought to listen to the doctor as well. I mean, let's face it. It's never a good thing, and that's an extreme thing that he did. He must have been severely depressed, and he just felt he had nowhere to go, nowhere to run to, and he felt death was the only option. But parents, please, please, and please, remember your child is a miniature version of you. Your teenager is essentially who you were when you were a teen. So listen to them. Most teenagers complain that their parents don't listen, be it listening as in, leave me alone, I want to be by myself, or listening as in, I don't feel good, I need help, or listening as in the doctor told you something and you just felt you got it, you're going to do it your own way, and that's it. So that kid was extreme. He ended up killing himself. He probably didn't have to, but he did. He's dead and gone now. We need to learn from all of those people whose kids are dying as an extreme reaction to being pushed in the corner. So parents, please, if your child is depressed, your child is being bullied, your child is being molested, your child is being harassed, your child is being, prejudice is being acted upon them, is that even the word? Whatever combination it is, please, I beg you, listen to your children, go to see the doctor, and just consider that maybe what the doctor said is okay. There's something called a therapeutic trial, whereby you give the medication for X amount of days or weeks, and if it doesn't help, well, at least we tried that, you know? In this case, I recommended counseling and medication, and the mom said no to both, and now we have a dead child. Okay, so that's one scenario. The second scenario is a 16-year-old girl, but I'm going to leave that alone because I have Elizabeth here asking a very, very good question. Her question is an ADHD question. So what do you recommend for a 12-year-old girl to stay focused at school without resorting to medication? So here's the first question. I am a pediatrician. I am a child advocate. I am the voice of the kids who feel unheard, unseen by their parents or the school or whoever. Elizabeth, the first question to you is, has your child been officially diagnosed with, or the child been officially diagnosed with ADHD? If the child has been officially diagnosed with ADHD, my sister, medication is part of the 3 things we need to do. It's a 3-pronged treatment. The first one is medication. Well, the first one really is education. Education, education, education. If your child who is 12 years old, what are the, Elizabeth, if you're watching me, please, can you write down the symptoms your child is having? Let me see. Yes, she has, she says. She has been diagnosed with ADHD. So if your child has been diagnosed with ADHD already, then your doctor must have told you medication is part of the three-pronged approach towards treating ADHD. It's not only medication, but medication is one end of the triangle. The first and most important end is education. What I tell my parents to do is educate yourself. That which you don't know, you must educate yourself about. There's no ifs, ands, or buts about it. And let me ask you a question. I'm going to take it outside of the medical sphere. What if your child, we're not talking about ADHD now, we're talking about she's been diagnosed with pneumonia. Everyone knows, oh my God, it's pneumonia. Pneumonia can kill. If your child has been diagnosed with pneumonia, it's the same three-pronged approach. The first thing is education. Your doctor is going to tell you all about pneumonia, all the things that we need to know about pneumonia, all the bad things that can happen with pneumonia, all the bad things, all the good things that can happen when you treat pneumonia. That's numero uno, education. The second thing your doctor is going to say is medication. We have to take medicine because medicine will help your body fight the infection that much better. If it's a viral type pneumonia, which is the most common type pneumonia, now we're being really superficial here, but if it's a viral type pneumonia, which is the more common kind of pneumonia, chances are your child can be treated without medication. But education is key. Medication is number two. And then the third thing is support. If your child is diagnosed with pneumonia, chances are you're going to take the day off. You're going to take the day off or the week off and stay home with her in the hospital, right? Because they're minor, they cannot stay by themselves. Support. But the most important thing is now you know your child there's a name for the diagnosis. Oh, and she's writing some more. Elizabeth says she's easily distracted, she's grouchy, she's hyperactive at times, she cries when she doesn't understand schoolwork, she tried medication and counseling. Thank you so much for being honest and bringing it out. So she says her child has a history of being easily distracted, being grouchy, being hyperactive, and she cries when she doesn't understand homework. As an adult with ADHD, I'm here to tell you that I have gotten better at being myself to some extent. But when I was a younger child with ADHD, I was not given medication, but I wish I had been given medication. I want you to hear me very well. I wish I had been given medication because there are studies that have shown that medication treats and helps with ADHD, but it's not medication alone. If you have a child who is easily distracted, that means if there's a little bit of noise, the child looks up, right? You have to also control the environment. And that's where the education part comes in. Everybody else in the class has to know that we have a child here who is challenged with being unable to focus. If your child cries when she doesn't understand the schoolwork, when someone has ADHD, there's always a possibility that they are what we call comorbid disorders. In other words, there's other things that are coexisting. Anxiety could be one of them. If she's scared, for instance, of math, let me just use that as an example, and she can't learn math, there is some degree of anxiety. Your doctor will need to figure out if there are other things coexisting with ADHD. What if she's dyslexic? When she cries because she doesn't understand, what if she's math lexic, like one of my guests on my podcast said? What if she's math lexic? What if she has issues understanding because she can't focus? What if she has issues understanding because she can't sit still enough? She's too hyperactive. So when we're talking about ADHD, medication alone, me, along with most good doctors, and hear me when I say good doctors, because a good doctor listens to their patients, a good doctor understands what their patient is going through, and a good doctor tries to sit down and explain. This is why I'm opening my direct primary care practice, where I'm going to spend 1 hour with each patient. I'm only going to see 6 to 8 patients a day, because the truth is, even the best doctor needs more than 10 minutes to spend with a patient, which is what traditional insurance and traditional medicine offers now. Sometimes you need an hour to get to all these questions that I need to ask you. She says she has tried medication and counseling. Believe it or not, from my own experience, and I have a lot of doctors watching me, please chime in if you can. Counseling is not one of the top things to go to when a child has ADHD. If there are other comorbid disorders, maybe counseling. Education is critical. It's not quite counseling, but education means mom, sit down, dad, sit down, little girl, sit down. My name is Dr. Lulu. Let's talk about your child's diagnosis. She has ADHD, which means she has that. First question is, mom, when you were growing up, did you experience any kind of symptoms that I've listed? Dad, do any of your brothers or sisters have ADHD? You have the symptoms that I've listed. Do you have ADHD? Because it helps you better when you can relate. You have to be able to come in where you can relate. Let me see any more comments. You have to be able to come in where you can relate to the child, right? Relate with the child, whatever the vocabulary is. And if your brother or your sister or your cousin or your nephew or yourself had ADHD or has ADHD, it is that much easier. I know one of my sons has ADD, probably ADHD too. I see it in him. We've tried to get help. In his own case, he was also dealing with his brothers going to college and suddenly being the only child and so on and so forth. But he also tried medication. And then he kind of grew up and grew into his energy. Does that make sense? Because we put him in basketball, we put him in other things, but we first recognized and accepted that he has ADHD. It is critical that your child is seen as being appreciated that they have ADHD, and therefore there is a struggle to deal with it. And Ellie says dyscalculia is math dyslexia. I know that, but my guest called it mathlexia, and I thought that was so neat. So I told her I was going to use it. But yes, I know dyscalculia is the correct word, but thank you, sweetie. But indeed, if your child has ADHD and they're dealing with that, it's a big deal for you to sit down in the classroom. Everybody else is getting it and you're not, because your mind is just continuously racing. And yes, the medication does have the effect of calming you down. Now, not all medications, like everything else, is good for everybody. What we always do is we start with the lowest dose and then we go up from there. If the first dose doesn't work, well, come back in a couple of weeks and we go up. The truth is, a lot of times, you have to try before you get to the dose that works. And sometimes when I max the dose, I change the medicine altogether. But that is why you and your doctor need the bestest relationship, because it takes a while sometimes. You might need counseling as a parent dealing with a child who has ADHD. But for the child who has ADHD, I wouldn't primarily say counseling unless there are other comorbid disorders. So I know I'm being very superficial, but hopefully, Elizabeth, that helped a little bit. And if you're watching me, my wife says, say it to the people at the back so they can hear. And I don't know where she said that, but essentially, I'm just saying, as a parent, please, if your child is diagnosed with anything, before you start saying, the doctor said my child has it, that's not my portion, or the Lord is my help, all of that is all good. But please remember that when you go to the doctor who took an oath to help your child, their job is to try to help your child. And your job is first to take the child to the doctor, but also to work with the doctor, because remember who is the object here is your kid. And you want to help your child, don't you? I know you do. So please, please listen to your kid, listen to the doctor, is a combination. Okay? But Elizabeth, which is my mom's name, by the way, holla at me outside of this. If you like a doctor who's going to have enough time to sit down and spend time with your kid, get on my website, Dr. Lulu's, what's my website? youthhealthcenter.com is my website, but my practice is called Dr. Lulu's Youth Health Center. And I don't know if you live in San Antonio, but even if you don't live in San Antonio, if you live in the state of Texas, I can do telemedicine. Okay, I'm licensed in the state of Texas. I can see your child virtually. I've been doing that for 11 months now, and I love it. You don't have to take off time from work. You don't have to take off time from, your child doesn't have to take off time from school. I will be glad to see your kid virtually. And yes, I can e-prescribe. I can write the medications electronically as well. So it's a win-win. I mean, what's not to love? So holla at your girl, okay? Next question. You have an 11-year-old daughter who loves her cell phone. We all know all our kids nowadays, they all love their cell phone. Let me see if anybody else is. Elizabeth said, thank you. You're welcome, sweetheart. And I hope that helped. Essentially, what I'm saying is medication is good. Medication is not the enemy, okay? And you're not the enemy either, but I think it's a combination of a bigger, broader perspective of what exactly is going on with your child. That is the answer that you need, okay? But medicine is completely fine. The right dose, the right diagnosis, and your kid is on her way. And actually, you know what, Elizabeth? A lot of my patients, when I finally start them on medication, they come back like in a week or two, and it's like night and day. The child is like so much better. The mom is so much calmer. You know, it's a win-win. Look, we could go on and on and on, but thank you for your question, okay? And if anybody watching me has a question, please ask away, okay? Ask away. So your 11-year-old daughter, you know, let me leave that one alone. Let me ask about the 20-year-old son or daughter who doesn't want to talk about anything. They just don't want to talk about it. They don't want to talk about it a lot of time. Well, I don't know what scenario. I'm just, okay, how about sex education? How about sex? Your child doesn't want to talk about it. I just don't want to talk about it. So because your child is 20 years old, at this point, you have to back off. There's got to be a reason why they don't want to talk about it. And what I do believe in my heart is eventually, when the time comes, they will come to you. And if they don't come to you at 20 years old, it's completely okay. Here's what I don't want you to do. I don't want you to push. If you push too much, what's going to happen? The kid is going to recoil, and we don't ever want that. Okay? So definitely we don't want that. So if your child said they don't want to talk about something, that's okay. If your child is younger, for instance, the 11-year-old girl who has a cell phone, and the last couple of times, or the last few times you've seen her on her cell phone, every time she gets off her cell phone, she's crying. Every time she gets off her cell phone, she's upset, she's irritated, she's slamming the phone, she's mad. Something is going on in that phone. Something is going on through that phone. And she may or may not want to discuss it with you, but you are the parent and that child is 11, and I think you probably pay for the phone. So what you're going to do is, from the get-go, when you give her the cell phone, you hopefully gave the rules of engagement, which means if you're being bullied, you better tell me. If if I ask you for the phone, I need to be able to get access to it. I need to have your password. Because a lot of kids, believe it or not, they want you to know. They want you to know. And if the child doesn't ask you, or rather doesn't answer you, maybe there's a favorite uncle, maybe there's a doctor that they will talk to. Case in point, yesterday I went to see one of my old-time schoolmates. Hi, Doris. And her daughter is 14, and we were talking about this, that, and the other. And the little girl actually opened up to me. Not too much, because she had only met me for 10 minutes, but enough for me to get a glimpse of the fact that, you know, her mom said she was the only child, and she had tried her out on like 10 different extracurricular activities. And I was like, there's something that's death by over engagement, over trying or whatever. And the little girl was like, she would try it, and then she said she doesn't want it. She would try. And I said, okay, have you asked her what does she want? And then the little girl was like, I want to play tennis. I said, bingo. Well, let's do tennis. So, I mean, it wasn't as simple as that. But what I'm trying to say is, if your child has a cell phone and your child suddenly starts crying every time they're on their cell phone, or they're upset, or they're pissed off, or whatever, when they're on their cell phone, you need to ask yourself that critical question. Is your child being bullied through the cell phone? Is there more to it that meets? Is there more to it that meets the eye through that cell phone? What else is going on through that cell phone? Okay? Ask yourself that question and take it from there. Go into the room when she's quiet, or maybe another time when all of this is not going on, and then ask her what's going on really. But start by telling a story. I find that telling a story about yourself telling you, sharing something personal about yourself a lot of times helps other people open up. Make yourself vulnerable for your child, yes, for your child, and let your child open up that route. Okay? Then and I don't know if she's still watching, Latoya Nuami, she had asked a question in the parenting group last week. She said something about having a 15-year-old girl who is otherwise straight A student, otherwise doing good, really, about everything, but she just wants to be left alone. And so the first question I asked Latoya is, how were you as a teenager? And Latoya said, you know what? I like to be left alone myself. And I said, well, remember that. If your child indeed is a straight A student, she's well-rounded, so to say. I can't remember all the qualities she had thrown out. But I said, if your child is indeed doing all of those other things that you said to us, and all she wants is just to be left alone. Oh, yes, she said when she gets home, she just wants to go in her room and just stay alone, maybe on her phone or something. And so what I told her to do was set up some kind of rule of engagement. So, okay, you know what? You can spend 2 hours with the family, and then you can go to your room. So just kind of negotiate. Try to meet in the middle somewhere. Or tell her, okay, sure, you can go to your room today, but tomorrow you're going to spend the time with the kids, with the siblings. But then when we started talking more, it turned out that the child immediately next to the 15-year-old is 7. How many 15-year-olds do you know out there that want to hang out with a 7-year-old sibling? And then after that one is a 4-year-old or something. Nobody who is 7 years old, who is 15 years old, wants to hang out with their 7-year-old sibling. It's just the way it is. And so I was like, bingo. They probably aggravate the out of her. That's why she doesn't want to be with y'all. So I said, well, why don't you make mommy and me time? It's your sacred time. It's your untouched time. And then tell her to just try to sell her siblings to her and also explain to her siblings that this is what is going on. I think a lot is lost when we stop communicating with our teenager because we forget that your teenager is just an overgrown toddler, really, you know? Communicate with them. Sit down, find a little crack and go in through that crack. You know, tell her, well, you know, I said, well, tell her that when you were her age, go in her room and tell her that, you know what, I completely understand why you want to be left alone, because when I was your age, I also wanted to be left alone. And I asked her, I said, but Latoya, what did your parents do? She said her parents didn't even really care. I said, well, I'm glad that you care. So tell your child what's going on and take it from there. Hi, Christine, hello. And so all of that being said, the main thing I wanted to do today was just to say that, asking your questions, of course, but also to say that when it comes to parenting your teenager, the most important thing, honestly, is to remember that they want to be heard. They want to feel like they're being heard. But that doesn't mean that you stop being their parent. Yeah, you're still going to parent them, and you're still going to, you know, tell them that you hear them. But there will always have to be rules of engagement. Everybody needs some kind of rule of engagement. Okay, so you can go to your room and play on your phones for 2 hours, and then you can come downstairs and play with your siblings for 2 hours. To me, I feel like if you give her a little bit, it's better than say, no, you cannot. I have said it. I'm your mom, and that's it, you know? So that was that about that, okay? And the last question I have is, oh yeah, when I went to the YMCA a couple of days ago, we had a bunch of teenagers, and one of the teenagers, the YMCA youth director, came and told me, Dr. Lulu, that's one of the ones that you're going to need to talk to. And I was like, why? And he said, oh, he just wants to be a thug. He just wants to be a thug. Because we heard the little guy say something like, oh, you know, I just got out last week. And it was a lie. He was just trying to make it sound like he just got out of jail. And so I told the teen coach guy, I said, you know what? Well, at least he's telling you, at least he's talking, at least he's communicating. And that is important in the sense that we don't know what's going on with that boy at home. For all we know, everyone around him is a thug. And then, of course, he was like, yes, yes, that is true. Most of the kids around here, it's a really rough part of town. It's like the southeastern part of San Antonio is the Walzam YMCA. And he was like, yeah, a lot of the kids here, their home environment is just, is lacking in love and hugs and all that. Because if you think about it, a kid who is happy at home, who everything is available for them, and it's not about being a single parent. I'm very quick to correct people about that. I was a single parent for a minute, okay? So being a single parent doesn't mean your child doesn't have everything that they need. Being a present single parent is the key. If you're a single parent and you're not present, then you might as well not be a parent at all. And that's where I'm coming from. So I tell myself, you know what? You never ever know what the situation in that child's home is like. My guess is it's probably like he comes from a thugged out background. Maybe the people there are all, maybe they're in jail, maybe his family members are in jail. So the best thing to do is to just sit him down and ask him why he feels a need to be that when he could do a whole lot better, something like that. Anyway, that was how I that was what I said. I spent only 1 hour with them, and the little guy, I could tell even during the session with the teenagers, he was obviously troubled because he said he was listening, but he wasn't hearing. He said it himself. He said, "I'm listening, but I'm actually like sleeping, and I'm not really hearing what you're saying." People like that obviously need a lot more than just 1 hour in a group setting. They probably would do a lot better with one-on-one. And if in an ideal world, would probably benefit from a home visit from that therapist and that counselor. But we can't do all of that. So he has to make do what he has and try to counsel him when it comes to the YMCA. But I think my main message for him was, I'm so thankful that you're here and they're able to get in touch with, not get in touch with, to come to the YMCA and have like a home setting and feel comfortable when they come. And for me, that was really all she wrote. Okay, so I have one last scenario here, and then I'll leave you all alone. This is a scenario of a 16-year-old female with recent anger issues and recent withdrawal. A 16-year-old female with recent anger issues and recent withdrawal. The reason I say that is because one of my guests during my podcast actually kind of touched on that. And when you listen to the podcast, you will hear it. It's called Suicide Pages. So please download it. We'll talk about that later. But the little girl was okay. She was happy. She was a regular teenager until, boom, one day, she's no longer a happy teenager. She's withdrawing. She's angry. She's acting out. Needless to say, that child needs to see me ASAP, right? You need to find the nearest counselor, the nearest therapist, the nearest pediatrician, hopefully the nearest psychiatrist, but especially a pediatrician, and of course a counselor, because we need to figure out what's going on. If the child is 16, chances are either maybe she's been raped, she's severely being bullied, she's severely being ostracized at school, she has no friends. As a matter of fact, the little girl that we're talking to yesterday, she's 14, she said, I asked her if she had a best friend, and she said, I don't have a best friend anymore. And so I asked her what happened, and little girl drama, the best friend became friends with someone else, and then they said something about her and all that. And I was like, that's okay, this too shall pass. Get yourself another friend or whatever. And we talked about that. But what I'm saying about this 16-year-old girl is, for all you know, she's being bullied, she's being raped, or she's being ostracized. And a lot of times, I'm saying this because I'm Nigerian, and for the Nigerians watching me, you know what I'm talking about. A lot of times, be very, very careful about that uncle that comes to the house, about that cousin that lives in the house, be it male or female. Be it male or female. I'm going to say that one more time. Be it male or female. Whether your child is male or female, whether the relative is male or female. I have no faith anymore. I used to, but not anymore, with any grown adult that lives in the home with your child. Be very, very careful. Put cameras everywhere. Put cameras everywhere. Ask your child if they are being touched inappropriately. And please, for everything that is good in this world, believe your child if and when your child comes to you and tells you that they are being touched inappropriately. I do not know any kid who makes that up. I do not know any kid who wants to get you in trouble by saying you're sexually molesting them. I'm a pediatrician, phenomenally one so. I'm a mom. There's no way you can convince me that a child is going to come and tell you that he or she is being touched inappropriately and they are lying. And when you listen to my podcast, hi, Christy Green, when you listen to my podcast, you will hear adults talking about being molested by other adults and their family members believing the adult. You will hear of stories of adults today who were children and they were being molested by adults. And when they told their parents or told their family members, they sided with the offender. This happens every time. So that 16-year-old girl who suddenly becomes withdrawn, suddenly starts getting angry, God help us if they start cutting or start hurting themselves, they have been majorly something going on with them. Please believe me when I say happy people do not want to kill themselves. And I learned something new. Hurt people who are not heard hurt other people. Most people say hurt people hurt people. No. If you've been hurt and you have been heard, you will not perpetrate the behavior. Okay? And on that note, I'm going to say so long, farewell. I'll see you all next Sunday. We'll have another topic, hopefully exciting topic. If you're watching me and you're in my parenting group, or if you're watching me and you're not in my parenting group, please join. It's free to join. It's called Dr. Lulu's Parenting Your Teen program. We have, for those who missed last week's part 1, we have part 2 again this Wednesday at 6 p.m. It's via Zoom. Please download Zoom. And if the time is not going to work, we're going to come up with another time. A bunch of people said Saturday will work for them. So we're going to do it on a Saturday morning. It might be this coming Saturday or maybe it's the Saturday after next. I'm not sure yet, but we're going to do it. We're going to do the same. It's about communicating with your teenager. Trust me, you don't want to miss it. Please join. It's a full course. When I say free, I'm not like other people that just do a little taste of it. That's not who I am. That's not what I'm about. I want to change stuff. I'm not a follower. You're getting a full course. It's 40 slides deep. It's a lot of nuggets. And for those who attended, high five for attending. We're going to do part 2 this Wednesday at 6 p.m. Central Standard Time. Please join the group. I'm only going to share information with the people in the group, okay? And then if you're watching me and you have not heard yet, my podcast is out and we're getting great reviews. Thank you all so much. For those of you who are not watching, who don't know yet, it's called Suicide Pages. It's free to subscribe, so please subscribe, download, listen, leave me a comment and maybe even a rating, okay? We're on Spotify, we're on Google Play, we're on Apple Podcasts, which is AKA iTunes. So we're on 7 different platforms. I don't know all the others. We're also on Anchor, actually, so that's 8. So please, if you find it in your heart to have 99 cents to donate, please do. Portion of the proceeds are going to be used to assist with Habitat for Humanity. If you know me, you know I'm all about service. I'm all about volunteering. We're gonna try to help. So on that note, thank you all so much. It's always a pleasure to come and just spend Sunday afternoon with y'all. And everyone who's watching me today, let me see if I can do a quick shout out. Doris, hi. The wifey, hi. Ellis, hi. I got one person on Teen Alive, but I don't know who they are. I can't see them. Otherwise, I have on my Facebook group, I have Chinyere. She's a late comer. Chichi, you know what time we do these things. I don't know why you always come late. All right. Hi, Terry. How your kids doing? Been a while. Beverly. Hi, Christy Green. Hi, David Dayton. Christiana Obi. Katibi, my classmate. Hi. Obi Nauzibo. Hi, my boo, my neighbor, my brother, with whom I'm well pleased. Jessica Taylor. Hi. Regina Allen. Hi. Christine Green, my second boo. Hi. Mati Torres. Hey, girl. Macaulay Onibo. Wakanda forever, bro. Kim McNeach, hi, sweetheart. Elizabeth, thank you so much for your question. It was awesome. Rebecca, hello. Hi, Linda, telling me to say it loud for the people at the back. Thank you. Sandy Mendel, hello. Hi, Cut Class 1206, what's going on? Amina Faruqi. Kamisha Duncan, Neka Uba. Hi. Selena Wabalba, hello. Ngozi Oriaku, hi, sister. Adeze, watching a Miriam Ofodile. Hey girl. Tahira Best, hello. Ijoma Ozibo, hello. Jan Tang, hello. Hi girl. Elizabeth Lydia Auta, my big sister, hello. Starla Fitch, what's going on? Tonya Storet, what's going on? Nenengweke Japacha Latoya, hi sweetheart. Linda Beckham, Yun John, Allison Webb, and Jali, my soul sister, and Veronica Garris. Thank you all so much for joining me today. Thank you all. I'll see you all next Sunday. Stay blessed. And remember, parenting is hard. It is the most difficult thing you ever did, but it is also the best thing you're ever going to do in your life, hands down. Raising another human. Are you kidding me? Of course. So on that note, I'm going to say goodbye. I'll see you all next Sunday. Peace out.